Cancer often manifests through subtle changes within the body. These changes can be easily overlooked or dismissed initially. Recognizing these early signs is crucial for timely diagnosis. Early diagnosis significantly improves treatment outcomes and prognosis. Unexplained weight loss without changes in diet or exercise can signal underlying health issues. Significant weight loss may be an early indicator of various types of cancer. This is because cancer cells can alter metabolism and energy usage in the body. Consult a doctor for evaluation if you experience unexplained and significant weight loss. Unrelenting fatigue, even with rest, may indicate a health issue. Persistent fatigue is fatigue that does not improve with rest or sleep. It is important to note that fatigue can be a symptom of many conditions. One potential underlying health issue related to fatigue is cancer. Cancer can cause fatigue through various mechanisms. If you experience persistent fatigue, seek medical advice. Changes in bowel habits, like constipation or diarrhea, need medical evaluation. Prolonged constipation requires assessment by a healthcare professional. Persistent diarrhea also warrants a healthcare professional's evaluation. Prompt evaluation helps in identifying and managing underlying health issues. Unexplained bleeding from any bodily source requires immediate medical evaluation. This includes bleeding from the urinary tract, rectum, or during coughing. Prompt attention can help diagnose the underlying cause of the bleeding. Early diagnosis allows for timely treatment and better health outcomes. New moles appearing on the skin can be a potential sign of skin cancer. Changes in the size, shape, or color of existing moles should be monitored. Sores that do not heal within a reasonable time frame can also indicate skin cancer. It is important to regularly check your skin for any unusual changes or new growths. Early detection of skin cancer through regular skin checks is crucial. Consult a doctor if you notice any suspicious moles or sores on your skin. A persistent cough, lasting weeks, warrants medical evaluation. Unexplained hoarseness should also be promptly checked by a doctor. These symptoms can potentially indicate underlying health issues. Specifically, they might be signs of lung or throat cancer. Early detection through medical examination is crucial for treatment. Dysphagia is the medical term for difficulty swallowing. Persistent dysphagia can be a concerning symptom. It may indicate underlying issues in the esophagus or throat. Dysphagia can sometimes be a sign of esophageal cancer. It can also be a sign of throat cancer. Medical evaluation is crucial for persistent swallowing difficulties. New lumps or thickening found in the body require medical examination. This includes areas like the breast and testicles. Prompt examination helps in early detection. Early detection can improve treatment outcomes. Consult a healthcare provider for any unusual changes. Night sweats, when severe and not due to environment, can indicate health issues. Heavy night sweats, unrelated to room temperature, warrant medical evaluation. Medication side effects should be ruled out as a potential cause of night sweats. Night sweats can be a symptom of certain cancers, such as lymphoma. Consult a doctor to determine the underlying cause of unexplained heavy night sweats. Chronic indigestion or heartburn requires medical attention if unresponsive to standard treatments. Persistent symptoms warrant investigation by a healthcare professional. Ignoring chronic indigestion may lead to overlooking underlying medical conditions. A doctor can assess symptoms and determine the cause of the indigestion. Further tests might be needed to diagnose the issue. Early diagnosis and treatment can prevent complications from chronic indigestion. Persistent pain without a clear cause requires medical evaluation. Evaluation helps rule out potential underlying conditions. Underlying conditions may include serious illnesses like cancer. Early detection through evaluation can improve outcomes. Sores that don't heal within a few weeks can be a sign of underlying health issues. One potential cause of non-healing sores is skin cancer. These sores or ulcers require medical evaluation to determine the cause. Early detection and treatment are crucial for managing underlying conditions. Consult a healthcare professional for any sore that persists without healing. Blood in urine, hematuria, or stool, hematochezia, melena, is a serious symptom. It necessitates prompt medical evaluation to identify the underlying cause. Possible causes range from minor infections to severe conditions like cancer. Ignoring this symptom can lead to delayed diagnosis and treatment. Seek immediate medical attention for proper diagnosis and care. White patches inside the mouth or on the tongue are known as leukoplakia. Leukoplakia can potentially be a precancerous condition. These patches appear as flat, white areas that cannot be easily scraped off. Regular oral examinations are crucial for early detection and diagnosis. Any observed leukoplakia should be promptly evaluated by a healthcare professional. Swollen lymph nodes can indicate infection or cancer. Lymph nodes are small, bean-shaped glands throughout the body. They filter substances and help fight infection. Swelling often occurs near the site of an infection. Persistent, painless swelling requires medical evaluation. Consult a doctor for proper diagnosis and treatment. Changes in bladder control warrant medical consultation. A healthcare provider can help identify potential causes. Early diagnosis is crucial for effective management. Discuss new or worsening symptoms promptly. Unexplained anemia is characterized by a low red blood cell count. Anemia means the body doesn't have enough red blood cells. Low red blood cell count can result in fatigue and weakness. In some instances, unexplained anemia can be linked to certain cancers. It is important to consult a healthcare professional for evaluation. Early diagnosis and treatment are crucial for managing underlying conditions. Persistent and severe headaches require medical attention. Headaches can indicate underlying health issues. Seek medical advice for recurring or intense headaches. Neurological symptoms alongside headaches are concerning. Medical investigation can identify the cause. Early diagnosis improves treatment outcomes. Any sudden or gradual changes in vision require evaluation by an eye doctor. An eye exam helps determine the cause of the vision changes. The evaluation is crucial to rule out any underlying health conditions. Early detection and treatment can prevent further vision loss. Prompt medical attention ensures timely management of potential health issues. Unexplained hearing loss requires assessment by a medical professional. Sudden hearing loss should be evaluated promptly. One-sided hearing loss also warrants medical attention. Professional assessment is crucial for proper diagnosis and care. Mouth ulcers are sores that appear in the oral cavity. Most mouth ulcers are benign and heal within a few weeks. However, persistent ulcers require medical attention. Ulcers not healing in a few weeks need examination. A dentist can assess the ulcer's characteristics. A doctor can also evaluate for underlying conditions. Dyspnea, or shortness of breath, is the subjective feeling of breathing discomfort. It can manifest as difficulty inhaling, exhaling, or a sensation of air hunger. New or worsening dyspnea requires immediate medical evaluation. Possible causes range from pulmonary to cardiac conditions. Prompt diagnosis and treatment are crucial to prevent complications. Ignoring dyspnea can lead to serious health consequences. Persistent abdominal pain requires medical evaluation. Evaluation aims to determine the underlying cause of discomfort. Identifying the cause is crucial for proper treatment. Ignoring persistent pain may lead to complications. Jaundice is characterized by yellowing of the skin and eyes. It often indicates underlying issues with the liver. Jaundice can also signal problems in the gallbladder. In some cases, jaundice may be a sign of cancer. A biopsy is a medical diagnostic procedure. It involves extracting a tissue sample from the body. The sample is then sent to a lab for microscopic examination. The primary goal is to detect the presence of abnormal or cancerous cells. Biopsies are crucial for confirming cancer diagnoses. They provide definitive evidence for treatment planning. Imaging scans visualize internal organs to detect abnormalities. X-rays use radiation to create images of bones and dense tissues. CT scans use X-rays to create detailed cross-sectional images. MRIs use magnetic fields and radio waves for soft tissue imaging. Blood tests are valuable diagnostic tools in cancer detection. They can identify specific cancer markers present in the bloodstream. These tests also reveal abnormalities potentially linked to cancer. Detecting these markers aids in indicating the presence of cancer. Mammography is a screening tool for early breast cancer detection. It aims to identify cancer before symptoms become apparent. Regular mammograms can improve chances of successful treatment. It involves low-dose X-rays of the breast to detect abnormalities. Early detection through mammography can lead to better outcomes. Colonoscopy is a screening procedure used to detect colon cancer. It also helps in identifying polyps within the colon. Polyps are growths that can potentially become precancerous over time. Early detection of polyps allows for their removal, preventing cancer. Colonoscopy is a key tool in preventing and managing colon cancer risk. Pap smears are a screening test for cervical cancer. The procedure involves collecting cells from the cervix. These collected cells are then sent to a lab for examination. The examination aims to detect any precancerous or cancerous changes. Early detection through pap smears improves treatment outcomes. The PSA test is a screening tool for prostate cancer detection. It measures the level of prostate-specific antigen, PSA, in the blood. PSA is a protein produced by cells of the prostate gland. Elevated PSA levels may indicate prostate cancer. However, high PSA can also result from other prostate conditions. Further evaluation is needed to confirm cancer diagnosis. Regular medical checkups are vital for maintaining overall health. They enable early detection of potential health issues and diseases. Early detection significantly improves treatment outcomes. Checkups can identify risk factors before they develop into serious conditions. This proactive approach allows for timely intervention and management. Regular checkups are crucial for early cancer detection and prevention. Genetic factors can significantly elevate the risk of developing certain types of cancer. Family history is a critical element in assessing individual cancer risk. A strong family history of cancer may indicate inherited genetic predispositions. Genetic counseling and testing can help identify and manage these inherited risks. Lifestyle choices significantly influence cancer risk. Smoking is a major lifestyle risk factor for many cancers. Diet plays a crucial role. Unhealthy diets increase risk. Lack of exercise is another lifestyle factor, increasing cancer risk. Conversely, a healthy lifestyle can lower cancer risk. Adopting positive habits is key for cancer prevention. Environmental factors can significantly influence cancer risk. Exposure to radiation is a recognized environmental risk. Certain chemicals in the environment can also elevate cancer risk. Identifying and minimizing exposure is crucial for prevention. Further research is needed to fully understand these environmental links. A healthy diet is vital in reducing the risk of certain cancers. Diets rich in fruits provide essential vitamins and antioxidants. Vegetables offer fiber and phytochemicals that combat cancer. Whole grains contribute to a balanced diet and cancer prevention. Regular physical activity is a proactive measure in cancer prevention. Consistent exercise helps reduce the risk of developing several types of cancer. Exercise helps maintain a healthy weight, reducing cancer risk. Physical activity can improve immune function, aiding in cancer prevention. Exercise reduces inflammation, which is linked to cancer development. Aim for at least 150 minutes of moderate or 75 minutes of vigorous exercise weekly. Avoiding tobacco is a highly effective cancer prevention strategy. Tobacco use, in any form, significantly elevates cancer risk. This includes smoking, cigarettes, cigars, and pipes. Smokeless tobacco products also pose a substantial risk. Quitting tobacco reduces the risk of many types of cancer. Avoiding secondhand smoke is also crucial for cancer prevention. Protecting skin from excessive sun exposure is crucial for cancer prevention. Prolonged sun exposure increases the risk of developing skin cancer. Sun protection measures include wearing protective clothing. Regular use of sunscreen with a high SPF is also important. Seeking shade during peak sun hours can further reduce risk. Consistent sun protection habits can significantly lower skin cancer incidence. Vaccinations can significantly lower the risk of certain virus-related cancers. HPV vaccines protect against the human papillomavirus, a cause of cervical cancer. Hepatitis B vaccines prevent hepatitis B virus, which can lead to liver cancer. These vaccines reduce the likelihood of viral infections that increase cancer risk. Vaccination is a proactive measure in cancer prevention, alongside screenings. Cancer staging is a method used to determine the extent of cancer in the body. It assesses the size of the tumor and whether it has spread to nearby tissues. Staging also checks if cancer has spread to lymph nodes or distant organs. Understanding the stage of cancer helps guide treatment decisions and predict prognosis. Surgery is a common cancer treatment involving the physical removal of cancerous tissue. The primary goal of surgical intervention is to eliminate the tumor mass from the body. Surgery can be employed as a standalone treatment option in certain cases. It is also frequently combined with other treatments like chemotherapy or radiation. Chemotherapy is a cancer treatment that uses drugs to target cancer cells. The primary goal of chemotherapy is to kill cancer cells directly. Chemotherapy drugs can also stop cancer cells from growing. Another key function is to prevent the spread of cancer to other areas. Chemotherapy works by interfering with cell division. This interference can lead to the death of rapidly dividing cancer cells. Radiation therapy uses high-energy rays to treat cancer. The primary goal is to kill cancer cells directly. Radiation can also shrink tumors, reducing their size. This treatment targets specific areas affected by cancer. It minimizes damage to surrounding healthy tissue. Radiation therapy is a common cancer treatment option. Immunotherapy is a type of cancer treatment. It boosts the body's natural defenses. This helps the immune system recognize cancer cells. The enhanced immune response then attacks cancer. Targeted therapy is a cancer treatment using drugs. These drugs precisely target cancer cells. The key is to attack cancer without harming normal cells. This contrasts with traditional chemotherapy. Chemotherapy often affects both healthy and cancerous cells. Targeted therapy aims for fewer side effects. Early detection of cancer is crucial for improving treatment outcomes. Early detection significantly increases survival rates for cancer patients. Detecting cancer early allows for less aggressive and more effective treatments. Smaller tumors are easier to remove or treat with targeted therapies. Early diagnosis often means a better quality of life during and after treatment. Regular screenings and awareness are key to early cancer detection. If you notice concerning symptoms, seek professional medical advice. Consulting a healthcare provider ensures proper evaluation. Professional evaluation is crucial for accurate diagnosis. Early diagnosis and treatment can improve health outcomes. Staying informed about your health is crucial for proactive cancer detection. Early detection significantly improves treatment outcomes and survival rates. Understanding cancer risk factors empowers informed lifestyle choices. Regular screenings and checkups are vital for early cancer identification. Adopting preventive measures reduces the likelihood of developing cancer. Proactive health management is key to cancer prevention and early detection.